Okay, so hello everyone. Thank you so much for joining me. I hope that I'm audible. I'm sorry, my network is a bit shaky, as you might have seen that my videos are a bit hanging. So I'm not really able to share my video, but that's me there. And it's a great pleasure because today we are really privileged to have a really inspirational a person to talk with us today about policy making. And uh, that is Sneha. So Sneha is a health law professional, a US certified medical coder with specialization in home health coding and HPA compliance. She's well versed with health industry and legal aspects of healthcare industry and a strong background in compliance of pharmaceutical and life science sector in the US, UK, and Asia Pacific region. She's also an AMR advocate, and we engaged with her too in a previous program called the Future Leaders Against AMR. And she also has interest in public health policy, that is TOSHA's liability related to biologics, medical devices, and AI and machine learning, particularly in India. She's also interested in bioethics, patient safety, and medical negligence. So Sneha wears many capes. So she's also a microbiologist, and she's also an advocate of the Supreme Court of India. So thank you so much, Sneha. It's a great pleasure to have you today to engage us. And I really do appreciate that you sacrificed your time despite it being very late on your end to join us today. So thank you so much. I think the rest will join us as we continue. Sorry for the background noise. Thank you.
Hello, Daniel. Can you hear me?
Yes, we can hear you loud and clear.
Hi, Daniel, and hi, everybody. And actually, you don't have to thank me. I have to thank you because, this is a huge opportunity for me, and I can't express how happy I am and how excited I am to be speaking with the young and vibrant and dynamic talent of Africa today. So really, thank you for this opportunity. So, Daniel, would you like me to share the screen?
Yes, you can go ahead, please.
Yeah, I'll just do that. Just bear with me for a minute.
It's okay, no worries.
So I believe the only host can share this presentation. That's the setting. I'm not able to share.
Okay, are you okay? Let me just check because I've given you your co-host.
Okay.
So yeah, so just try, please. Are you able to share now?
No, Daniel, I don't know. And I can't even see the options of my screen actually. Just a second. Let me try it
Okay,
again.
it has started sharing on our end.
Okay. All right. I think then it's working. Is it showing?
Yes, now it's showing. Yes, it's there.
All right. Okay. So shall we start?
Yes, you can go ahead. Thank you.
Yes. So everybody, as you know that we are going to talk about the legal framework and policy making within AMR perspective, keeping AMR in mind and in focus. So let's start. So today, what I want to focus on is, I want you to understand your importance as a stakeholder in policy making and strengthening legal framework to act against AMR. So let's begin with our presentation today. So as we know, AMR is a global concern, of course. And so actually, I'm very happy that, we are sharing this platform today on the occasion of, World AMR Awareness Week. We are celebrating already. So this is a huge platform, and thanks to Daniel and his team and, SAS, that we are getting this opportunity to discuss. So let's, make this as an interactive session. Policy making and advocacy and legal framework per se is a very huge topic, vast topic. So I have tried to cover as many points as I can, so that you have some food for thought after this session regarding how you can act as a stakeholder in policy making, and what is the process of policy making, how it is implemented, what are the obligations, what are the hindrances in the implementation process of policy. So I have not covered any particular region as such, because more or less the process of policy making is similar in all types of all kind of nations. So what we are going to understand is, we are going to understand the basics of policy making. And as long as we know the basic of policy making, we are good enough to apply it to any kind of policy that we come across. And of course, in this session, we are going to keep AMR in mind and in focus. So as we know, AMR is a global concern. It is a widespread, we can say, disease which is demanding millions of lives in worldwide. And we all are aware of Lancet survey, which has already declared that millions of life, 4.95 millions, have already suffered because of this issue, and more, which is substantially more than HIV, AIDS, and malaria death worldwide. And unfortunately, they are predicting that by 2050, the death rate will be 10 millions by then. So this, of course, call for an urgent, strict and stringent action from all the ministries, from all the governments, UN, multi-sectoral collaboration, multi-stakeholder collaboration, and interdisciplinary approach. As we say, we are moving forward. We are looking forward to the One Health approach. So this is significantly important. And among, in all this scenario, since I'm also from India, and most of you are also from the African region, so we belong to the developing nations in LMIC. So these areas are more prone, and among them, the Western Sub-Saharan Africa is majorly affected. So yes, students, yes, friends, this is a wake-up call for all of us. So let's talk about what we need to act against this particular issue. So what we really need is effective governance for tackling the issue of AMR, and which is nothing but a good governance, which is open, transparent, which is, acting with integrity, which has effective collaboration from all the sectors, not only, not only restricted to medical, not only restricted to science, not only restricted to any particular research, but it has expertise from all the possible, all the possible domains in this world. So basically, a world without effective antibiotics can have drastic impacts on population health, development, and global economy. I think most of you are researchers, most of you are scientists, most of you are statisticians. So you all know, you must have gone through so many research papers that speak for this. And so we know the importance of antibiotics. And we also know the imbalance in the use of antibiotics. We are lacking sustainable approach, sustainable use of antibiotics in the developing countries, developed countries in LMIC. We are lacking the equitable use of antibiotics, and which is leading us to, we can say, the misuse of antibiotics, which is, taking us to this dreadful situation, which is being called as slow pandemic. We have already suffered one pandemic. We have already witnessed enough of devastation all over the world. And I think, being AMR activist, only we can sense that what these researchers mean by calling it by a slow pandemic. So we really have to be very aware of this particular phenomenon. And I think, as budding AMR activists, what we can do is we can initially start spreading awareness about this particular thing. Very simple thing. For example, I have a son who's 4 years old, who does not, who's very small to understand what antibiotics are, what is medicine, and what is disease, and all of that. But in my personal capacity, I always try to speak to him about what is antibiotic, what are germs, how antibiotics fight against germ, and the sustainable use of antibiotics. It's not like, whenever you fall sick, whenever you're showing any symptoms, whenever you're feeling feverish, you need to pop up that medicine. You always have to go to the doctor, talk about your symptoms, and get a proper prescription. It is only when a doctor feels right, then only you should take antibiotic. And he seems to understand the situation. So I think, yes, it does begin in our house. And that's how we should really, focus on spreading awareness among our society, community members, and talk more and more about the efficient use, the sustainable use of antibiotics. So multi-sectoral governance to mitigate its emergence and spread is absolutely required, because we know that this is not a public concern anymore. Usually policy making is takes place whenever there is a public concern that is identified, and there is so much of disturbance in the society that calls for the intervention by the ministry, by the government, and that's when the policy making process starts. But AMR, as we are aware of, is no more just a public concern. It has become a global public concern, and it may have the effects, the consequences that are beyond our imagination. So this definitely calls for multi-sectoral governance. And so when we talk about governance, friends, please understand that governance can be legally binding, and there is also a governance beyond governance, which can be non-binding. So legally binding global governance is what? Which means treaties and regulatory standards. So when there are so many nations who come together as a part and form United Nations, so they pass conventions, they pass guidelines, regulations, they form treaties, and they just set some standard rules and regulation to be followed as a standard, as a policy, which can be adopted by the nations, the member nations, or even the other nations who are, in need of that particular intervention. So that can be legally binding global governance. What is non-binding mechanism? What is non-binding governance? Non-binding can be the political declarations, which might be national, which might be local, which might be at the district level, which might be at the state level. So these are resolutions, these are guidelines, which maybe the local council, the state council identifies, by judging their local scenario, the needs of their particular community. So this is what is about effective governance. And in talking in terms of AMR, I think we know there are multiple of governing bodies, regulatory bodies that are coming together, not only WHO, not only the food and agricultural sector, not only the other sector, but also sector like WTO, World Trade Organization, sector like TRIPS, which deals with intellectual property. That is also, trying to do significant work against AMR by, incentivizing pharmaceutical industry, and encouraging them for production of effective and efficient antibiotics, and along with that, the equitable use, the equitable access of those antibiotics in LMIC as well as developed countries. So I think this is what is happening regarding AMR moving forward. So like I said, governance is of course there. The responsibility, the main work of governance is to come up with a policy, but to take that policy forward, so that that policy comes down to each level of the nation, each level of the community. There is a governance needed beyond this kind of governance. So what is this? So this is nothing but this is stakeholder engagement. So as you can see, there is this pyramid. I have taken this pyramid from a very good paper which talks about the government, ministerial intervention in dealing with this AMR issue, and how this particular state, Kerala state in India, came up with their own policy about stakeholder engagement, and how powerful it was, and how evident it was to show to the UN, to WHO, that this strategy can be implemented at this level. So this is that pyramid which speaks about the Kerala model, but we can always take it as a precedent. So let's try to focus on this pyramid. As you can see, the apex level is central government coordination. So like we spoke about the government intervention, which is the presidential, constitutional, ministerial intervention, whenever policy formation is taking place. So these are the formal network and formal stakeholders. So there is a apex body, okay, which identifies the problem, which senses a public concern, which understands that there is a need of policy implementation, and the decision is taken by this particular body, the apex body. So decision making power always lies with the apex body, which in this pyramid, as they're talking about, is central government coordination. Below central government coordination, the network further goes down to WHO, Ministry of Health and Family Welfare, which is the regulatory body of healthcare in India. The National Health Mission, national and state professional medical associations, and academic bodies. So this National Health Mission, State Professional Medical Association, these bodies are nothing but state council. These are the statutory bodies which are established as a statutory provision of the government. So this, we can say, this is the formal network of stakeholders. Moving forward, okay, now the policy, the decision has been taken. Let's just consider the decision to make policy, to implement policy, has been taken by this particular network, which we call it as formal network. Now, to implement this particular policy, what we need is, the policy is not only for the apex body, it needs to reach to every sector, every strata, every socio-economic zone of the state, of the country. And to do that, it needs to drip down to the regulatory body, which is working at the district level of the nation. So the third strata, as we can see, is the state command center, the public service departments. There are also these PPP, the private public partnership collaborations in strategic planning. Then public health messages, which are circulated, which are implemented by the social activist, and the social media plays very major role in this particular cause. So these are the informal networks and informal group of stakeholders. And the last, as you can see, is the knowledge exchange and capacity building through wider public and professional stakeholder. And students and friends, we play a major role over here, because we are students, we are budding researchers, we are budding professionals. And as I said, that awareness is the key to deal with this problem, and our role can exactly start here. So public participation through, there are different social activist groups, there are different public health working groups. Then there could be cooperation between public and private sector. As we know, a lot of these corporate industries, they are also now becoming aware about the different public health policies in their particular countries, and they're adopting these policies as CSR. So as I hope you know what CSR is. So CSR is corporate social responsibility. So this plays very important role, because this is a little different, out of the way segment of when we are talking about this AMR issue, but I think that can play a major role in dealing with this problem, because it is attracting attention from the corporate sector. And when we talk about corporate sector, we indirectly or directly, we talk about the economy of that particular sector, which also, is beneficial moving forward. So these are the things. So as we see that there is a formal network of stakeholders and there is informal network of stakeholders. So this, I think this pyramid makes it very clear and it's very easy to understand, and gives us the first glimpse of what stakeholder engagement can be. So legislation and regulatory tools play a key role in driving policy change and expediting NAP. So NAP, as we know, is the National Action Policy, which has been implemented as a result of global action policy that was implemented in the year 2015. However, to ensure accountability, transparency, responsiveness, rule of law, stability, equity, and inclusiveness and empowerment, a broad-based participation is required from all the players associated with the implementation of such policies. So who is this broad-based participant? This is nothing but the network of informal stakeholders. So this is what we are going to talk about today, friends, because government is always there, ministry is always there, they always do their part of forming policy, making policy and everything. But I think there is a high time that we start actively engaging into these policy making processes. We start advocating about AMR awareness in these kind of policy making processes. So let's move forward and let's see how we can exactly participate in this particular thing. So developing a good economic case to engage with policy makers. So student, what is economic case? I'm sure a lot of you must be, studying economics, studying political science. So you must be aware of this particular phenomenon, economic case. So economic case is nothing but, in order to achieve sustainable goals, where we have a policy. So we have a policy reform. So a conceptual network is required, which describes the outcome through scoping review of the policy. So instead of jumping straight to the objective, instead of jumping straight to the outcome, first a framework is formed, a conceptual framework, which talks about, or maybe we can say, which predicts whether this particular policy, the outcome of this particular policy will give us any sustainable, result, or it will not. So indirectly, this is linked to an economic benefit. So if you're able to come up with such a, economical approach, sustainable goal approach to the policy making, then I think that can always effect in the interest of that particular policy reform. So how can we do that? Okay, it's as simple as first identifying the policymakers, which means the stakeholders and the concerned policy areas. Now student, these are very general points, okay, but we have to keep AMR in mind. And just as I'm speaking, I would request you to apply this to the AMR concept as we go ahead. Then moving forward, there is political context of the subject matter and critical analysis. Then communicate as in, you may form policy brief. See, you are in your learning phase. So what you can do is, maybe you can take up some policy, which is you may not be able to get involved in the policy making process as of now immediately. But what you can do is, as an exercise out of your own interest, you can consider one policy that is being implemented in your own country against for AMR by your own ministry. You can study that particular policy. You can form a policy brief with the perspective that you need to advocate this particular policy to whoever, the social activist group, the interest group, as we call them, or any particular school, any particular, group of young people who are, very keen to know about this issue, who are keen to work against this, for this issue. So policy brief, basically, it just extracts the significance of that particular policy, and it enables delivering the objectives of that policy to that social activist group. And this is how maybe you can communicate about the policy. And this, I think this is the first start. This is the preliminary stage where you can start talking about policy. You can start engaging with the policy makers. You can start engaging with the indirect stakeholders that are involved in the policy making process. Then multi-sectoral collaboration, as we say, networking, network with as many people as you can. I think the best example of this, what we have experienced is like me and Daniel. Last year, we were part of this Future Leaders Against AMR. This was I think I feel this was the brilliant example of multi-sectoral collaboration, because there was so many, there was a diverse community of these AMR advocates, and so I feel is here as well. And that was really amazing, because when we were working on that project, it was so amazing to know a different perspective from a person who belongs to the different profession. So I think that really makes sense, and that is really effective and efficient in order to actually participate in the policy making process. Now, broadcast, what do you mean by broadcast? So let your work be known, publish as much work as you can, write, you can even write small blogs, make small videos. The generation of yours is so friendly with social media and reel making. Maybe you can make these small reels and everything, and through social media you can connect to as many people as you can, and you can make them aware that there is something called as AMR. You have to be aware about the sustainable use of AMR, and you should stop consuming antibiotics without prescription. So this is just an example that I'm giving you. You may have another example in your mind as well, and I would really like to know that in the end of the session. So all these strategies are long term, and they are goal driven solution. So economic case is nothing but we have to form a case, but keeping in mind that this will lead us to a sustainable approach, and this will not cost us any undesired result. All right. So yes, so here we come to the main segments of our session today. Okay, and so I have just tried to form it, divide it in 4 modules: module 1, module 2, module 3, and module 4. So this is how we are going to proceed with our session here onwards. We are first going to talk about the policy making process, the AMR perspective from the in developed countries, in LMIC, and the need for evidence in decision making. In module 2, we are going to talk about the implementation of policy. That is, we have policy, but how to take it from paper to action, and what are the challenges in implementation. I think the actual problem in policy making lies over here, the implementation, because of the patchy, we can say the patchy strategies and the fragmented way of implementing that policy, due to several reasons that we will discuss as we move forward. In module 3, we are going to talk about the resources and stakeholders engagement. So basically, we are going to talk about who are the players involved, and what kind of collaborative approach do we need to actually get engaged as a stakeholder. Here I'm going to discuss a research paper, a project that I was also part of, and it's very interesting, and I'm really glad that I'm able to share that with you. So we'll be discussing about that. Module 4, we are going to talk about role of students in policy making. So lobbying to promote allocation of resources. Lobbying, as we know, is nothing but influencing, but in a positive manner, which can, enable us to achieve our goals against this, fighting against this AMR. So Daniel, I just want to know if, everybody's able to hear me and I'm not too fast and this is fine.
Yes, yes. Thank you so much, Sneha. Yeah, we are following through very well.
Yeah. All right. I'm not able to see anyone, so I just wanted to make sure that I'm audible and everybody's following. All right. Thank you so much. So let's move ahead. So here I have just added this small picture which talks about, the policy making process in toto. So we have policy design, we have implementation tools, we have monitoring and evaluation. So just observe all the small, elements that are mentioned over here. So under policy design, we have strategic vision, participation, coordination, accountability, transparency, sustainability, and equity. I'm pretty sure that we are, so much into this issue that we are aware of these words and we keep hearing them. And, I think in my case, if somebody wakes me up from my sleep, I think I'll just start talking about what sustainable approach is, what equitable approach is, what is the, the rational use of antibiotics. So I think, but these things are very important, and these are the tools that we actually, if we go and implement it properly, we'll be able to implement the policy successfully. So these small elements are very important. So just these words, keep them in mind. Then implementation tools. So under implementation tools, we have surveillance, antimicrobial stewardship, IPC, then public, the awareness, education, the CME tools, CME elements, medicines regulation, then R&D, the antibiotics, manufacturing, production, and facilitating market access to novel products. This is also very important. So monitoring and evaluation. Monitoring and evaluation, why this is important? Because yes, we have a policy. Yes, we have a goal in our mind. Yes, we have, a strategy to implement as well. But what happens during this entire process? It needs to be monitored, it needs to be evaluated even after implementation, that whatever policy you had made, whether it is achieving the desired objectives or not. For this, monitoring and evaluate, the M&E tool is very, very important. So basically, it is nothing but a feedback mechanism to just ensure the effectiveness of this particular policy in AMR research. So let's begin with our module 1. Module 1 is about policy making process from the AMR perspective, as we discussed. So we are going to talk about the developed nations, LMIC, need for evidence in decision making. All right, so here we come to the focus, the main part of our discussion today. That is public policy making process. So basically, what is public policy? What is policy making? This term was coined by Harold Laswell, an important figure in the development of policy sciences at the University of Chicago and Yale University in the 1950s. So basically, public policy making process, like I said, whenever there is a disturbance in the community, disturbance in the society, that calls, that can be termed as a public concern, it just catches government's attention. It just needs the ministerial intervention in order to take some actions against that particular public concern. And how it is taken is immediately the policies form, the decision to making the decision to make the policy is taken by the higher authorities to maintain sanity in the mankind, thereby stabilizing the society. Because naturally we want to protect ourselves from this, whatever the happens that is happening in the society. Recently we have seen how the world dealt with COVID. So I think this can speak about that very well. In democratic governments, elected legislators formulate policies and implemented, which is implemented through various executive machinery. So, most of the democratic countries, they have this federal government nature. So where the federal government, the higher authority, the constitutional, the parliamentary, the parliamentary authority of that particular nation takes this decision that we need to intervene in this particular cause. We need to form a policy that will be implemented throughout the nation, and that will benefit and that will act for each and every citizen of the country. So this is how the decision is taken. But again, like we discussed about just if you can remember that pyramid, we talked about the direct stakeholders and the indirect stakeholders. So to implement this, what we need is the indirect stakeholders. So these are nothing but the public officials who act as the gatekeepers of the policy formulation system. And this policy making, friends, can be enacted in the form of new law, can be enacted as an ordinance. Ordinance is nothing but a law that is enacted in the emergency time, and a statutory instrument, or just mere regulatory guidelines. So basically this can be binding or non-binding. So what are the important steps? So basically there are 5 important steps in the public policy making process. The first, as you can see here in the picture, is agenda setting. which is nothing but public attention that focuses on a public problem or an issue, and in official words and actions, and help to focus attention. So basically, before agenda setting, there is one more process which is not, shown over here. That is nothing but identification of a problem. It may happen many times, that you may suffer from too many problems, that you don't have a clarity about what the concern is. But it is very, very, very important in order to form a policy that you identify the problem first. So identification of problem, I would say, is the first process. After that, there is agenda setting. Agenda setting is nothing but where the actual policy designing starts by the ministerial level, by the higher authorities. After that, there comes policy formulation. So basically, once the decision is taken to form a policy, for policy formulation starts, where policy makers in the legislature, or the bureaucracy, they take up this issue, they create a legislative, regulatory, or programmatic strategy to address this problem. So they just maybe sense how serious this concern is, whether the guideline should be binding or not, or maybe non-binding in nature. So that's how the formulation decision is taken. After that, after policy formulation, policy adoption, takes place. So what is policy adoption? Now, policy adoption is nothing but it can be in the form of statutory, that is legislative, where the act is enacted. So naturally, it is binding in nature. It can also be, it can also come as mere guidelines by the quasi-judicial body, by the statutory bodies or the regulatory bodies, and which may or may not be binding. So that is policy adoption. Adoption means how the policy framework is going to be adopted and how it is going to be implemented. Policymakers formally adopt a policy solution, usually in the form of legislation or rule. So I think here it makes it very clear. If it is in the form of legislation, naturally it is going to be binding. It is going to have serious implication for non-compliance. And rules, which is a mere set of standard, we can say, which can be adopted just to make, just to streamline things for in the society. So basically, policy making is nothing but a stable, we can say a stable, definite cause of action, which is decided by these public authorities in dealing with the problem of public concern. After policy adoption, there comes policy implementation, and after policy implementation there is policy evaluation. So I think these steps we already discussed, but we'll also discuss it again. So policy implementation is very, very, very important, because that is ultimately is our objective, and that is going to be the deciding factor whether whatever work has been reaped down through from the higher authorities to the lower authorities, the designing of the policy, the formulation, the adoption of the policy, whether it is actually going to be effective or not. So policy implementation is when the government agencies begin a job of making the policy work by establishing procedures, writing guidance documents, or issuing grants in aid to other governments. So basically, here what happens is these government agencies or statutory bodies or regulatory bodies, they just form a regulation, they just set they just lay down rules, you can say a set of standard, which can be then passed on to the lower authority, and further lower authority, the lowest authority, and then it can be implemented at the community level. So this is policy implementation process. After policy implementation, there comes policy evaluation. So policy analysts inside and outside government determine whether the policy is addressing the problem or whether implementation is proceeding well. Now, why outside and inside government? Why this kind of analysis is important? Because government is one thing where they are focusing on just strategizing the policy, keeping the objective in mind. But the people, the stakeholders, the agencies, the public authorities that are working outside this government, the government orbit, they are the people who are actually going to implement it, execute it. right? So it is very important that there is a symbiotic association between these two bodies, and there is a analysis which takes opinion from both of them into consideration. So this is nothing but, we can say, a delegation of work. There is a beautiful concept in law, that is delegation of powers, delegation of authorities, which is from the government to the executive body. So as we know, there are three pillars of the constitution of the federal government. The one is the executive body, one is the judiciary body, and one is the obviously legislating body. So this is how the policy is formed, designed, and formulated, and then it is implemented. Now, what happens during the policy evaluation process? Policy evaluation process, like I said, there is analysis from both the bodies. Then if they feel that this is not what we had planned for, this is not our objective, and this is not going in the right direction, it might ask the higher authorities, it might suggest, advise the higher authorities to go for revision of this policy making process. So what point I am trying to make here, friends, is please understand that it never happens that you have a public problem, you have designed a policy, and you have implemented it. This is a process. This is a, you can say, this is a vicious circle which just goes on and goes on and goes on. You have formed a policy, you have reached till the implementation stage, and you realize that, okay, we are distracting from our objective. Okay, there is one more public concern that maybe left our attention, we did not think about it, and we have to then go back and make some strategic changes, make some structural changes in the policy making, and again restart this entire process. So please understand, policy making is a process. It is never a result oriented, we can say, this thing. There may be thousands and thousands of other factors which might impact this entire process, and which might call for revisions and revisions of this process. But yes, this might come up with some positive, efficient results as well. So this is what is about policy making process. Moving forward, we will see, I think this picture makes it very clear, and most of us are very aware of these facts, that in developed nations, how policies are formed in developed nations, how they are formed in LMIC, what are the factors that impact policy making processes in these two regions. So in developed nation, obviously policy making process are nothing but they are implemented for as a efficient stewardship programs, we can say, for strengthening national and international governance, because financially they are much stronger, they have powerful executive machinery, and because of the integrity, we can say, of the ministry, of the constitution, of the parliament in these developed nations. Whereas in LMIC, the financial and government arrangements are always staggered. There is no uniformity. That doesn't mean that there is uniformity in the developed nations as well. They have their own issues. They face a lot of problems during the implementation process. But in LMIC and in developed countries, we know what is the situation. There is government, but there is corruption, and there are 100 other things that impact this policy. Policy always comes on the paper, but it never comes into action. That is the case. Now, knowledge resources sometimes is very poor, so most of the community, most of the lower socio-economic people, background people, they're not aware of this policy itself. Then what is the point of designing this policy when you're not able to benefit your citizens, that the last citizen of your country? Then there is no point in designing this policy. Public awareness, lack of public awareness, obviously it is there, and legislation is very poor, or I would say there are a lot of lacuna in legislation, enacting of public health acts in these particular countries. In India itself, so I'm a microbiologist. I decided to pursue law because I realized that public health legislation in India itself is a niche area, and there is so much to do compared to other nations. And that's how it fetched my attention, and I decided to pursue this. So this is the case about LMIC and the other developing countries as well. This picture clearly talks about the health coverage, the number of population that is covered under health coverage in these particular nations. So need for evidence and decision making. I'm sure most of you are researchers and very well aware of the importance of evidence and decision making. So evidence is nothing but we can say is a precedent which can help us, going from a theoretical approach to the empirical approach with high quality evidence. Empirical approach is what is it? It is not merely based on, a logic or reasoning, but it is, we can say it is a result of the observation of the different research that has been taking place. So randomized controlled trial, RCT, as we know, is one of the tool that is very effective when we are talking about evidence in decision making. So best available evidence from the most relevant research on the policy development and implementation is nothing but evidence-based decision making. This is very important when we are evaluating piloting stage, testing and scaling of effective policies around the globe. Set of methods focused on policy process than aiming straight on the objective. So basically, this is the point which is very important about the evidence in decision making, which is 100% impactful and successful outcome of the policy as compared to the theoretical approach. For example, randomized evaluations in India, Ghana, Kenya for learning level of students. This was a research that was conducted in these particular countries. You can go back and check about this very interesting project, and where this evidence in decision making actually played a major role. So the prerequisite for using evidence in the decision making of policy making process is nothing but you need a quality data, credible statistic to deliver unbiased, substantive, actionable, equitable, time effective, rigorous and pragmatic outcome of the policy. This is very, very important. So that is what evidence-based evidence-based tool talks about in policy making process. This picture, this is one of my favorite research papers. I'm not a scientist, I'm not a researcher, but I do keep reading, research papers. And I think this gives you a different dimension. I'm not sure about the time. I think we are moving ahead in the time, but you can observe this thing. So here what we have is, basically this picture talks about how policies are formed, on what levels policies are formed, what are the factors that are taken into consideration while policy making process, and how it is implemented. So here they have selected government levels and the regions. The broader patch that you can see is the maximum regions that are covered in this particular implementation region, and which has implemented these particular policy options. So I will not go into detail, but this is a very, self-explanatory image, I would say. And it talks about the various policies that have been implemented against AMR, like funding, obviously it's there, public awareness, committee development, vaccination guidelines, the vaccination drive, which is important. This is interesting, reimbursement penalty patient, and down you can see reimbursement penalty physician. So basically this is reimbursement to the patients when doctor fails to justify that there was existing infection against which the antibiotic was prescribed. If he fails to justify that, there is a penalty for the physician. Of course, this has started in the developed countries. This is getting implemented in the developed countries, but in developing countries and LMIC, it is very difficult to implement this. And there are other factors as well. So let's move ahead. And let's move to our module 2, implementation of public policy. So like we discussed, why implementation is very important, because that is going to decide whether whatever we have designed in the policy making process is going to be effective or not. So from paper to action, the approaches are nothing but setting the goal, planning, achieving impact. So in this entire process, this presentation I'm going to share with you, so you can always have a look at this. But what I want to discuss with you is there are two things that you need to ask yourself when you're studying any implementation process, or you are actually involved in the implementation process. Keep asking why. Question why your approach is right. Why would others take the action required? And how do you know that? continuously testing against the data and evidence from the front line. So these two questions are always important when you're in the process of policy making. So these are the different approaches that are very important when we're talking about the implementation of that policy. That is top-down approach, bottom approach. These are the main two approaches which we also find, I think, in the other fields of our political science and educational field and all of that. So top-down approach and bottom approach are the main two approaches, under which then there is synthesis, reconciling approach, structure approach, procedural approach, political approach. So what is top-down approach and what is bottom-down? I'll just quickly explain it to you. Just imagine, when we are talking about top-down approach, imagine a straight normal pyramid, and when you're talking about bottom-up approach, you just imagine an inverted pyramid. So in top-down approach, what happens is the decision-taking authority lies with the apex authority, the highest authority in the hierarchy. Also, the policy designing authority also lies with them. And merely the execution, merely the implementation is delegated to the lower authorities. Whereas in bottom-up approach, what happens is decision still lies with the apex authority, but designing, formulation, policy adoption, all these things are, they are designed, they're opined by the lower authorities, which is suggested to the higher authority, and then maybe higher authority takes all these opinions into consideration and takes a decision. So naturally it has its own pros and cons. Top-down approach, it has clear goals and objectives, but it's a comprehensive way of designing policy, and it goes by theoretical approach, because everything is done by the higher authority and just the execution is left to the lower authority. Whereas in bottom-up approach, there is a bit of ambiguity in the objectives, because naturally implementation is being executed by so many stratas below the pyramid, and it is just being passed on to the apex authority. So which may be sometimes pragmatic, but along with that, it is very important that this approach can be sometimes very empirical. So this is also very important. Now, synthesis reconciling approach, what is this? This is nothing but communication and negotiation, that command and control. So earlier we talked about outside the government and inside the government. So this is that approach. So basically federal government seeks opinions from the local government. Then there is a reconciliation, there is a discussion, negotiation among them, rather than just passing on the deterrent, just passing on the, sanction, which is very hard in nature, which is very commanding and controlling. And so basically strategic delay are also used in policy making processes. This is nothing but just to take a pause in between the process and gauge how the process is happening, where we are lacking, what are the lacunas, whether it is getting us closer to our objective or not. Structure approach, it depends upon the structure of the organization. How is the interrelationship between the parts of the structure? What is the hierarchy? And according to that, policy designing is decided. Procedural approach is nothing but the administrative approach, managerial. So most of the regulations, guidelines are passed on by the quasi-judicial body or statutory bodies, but they are non-binding in nature. Political approach is very, very important, and especially in case of AMR, because as we see, there is a lot of international treaties and conventions that are taking place. So this is nothing but intergovernmental coordination, which mostly takes financial support into consideration. So these are different approaches. You can always go into detail of each of the approach, but what interests me more is the top-down approach, the comparison between the top-down approach and the bottom-up approach. So challenges in implementation, this is very this figure talks very generally, but I think most of the tools are very applicable in case of AMR. Serious implementation challenges remain throughout the policy life cycle. For example, policy formed and target adopted without considering implementation sufficiently, not enough focus. So I'm just reading randomly. You can go through it in detail later on. Then there is patchy outcome of data collection. So I'll just quickly give you one example to make you understand this. In India, there is a regulation of antibiotics. There is a that coded law for implement regulation of antibiotics under the Drug and Cosmetic Rules of India, where there is Schedule H1, which says that sale of antibiotics without prescription is prohibited. Basically, OTC is prohibited. Okay, so we have a codified law, we have a law in place, but if you go to village place, leave village place, even if you go to metro city, if there is a community, pharmacist, you will always see that antibiotic is being dispensed by a non-skilled person, by the medical owner, just without prescription. And people are also involved in self-medication because they know that, okay, this is the name of the antibiotic, this is what the doctor had suggested last time, so I can take this again and I can feel better. So this is where the serious challenge in implementation can be seen. There is a codified law in place, but what is happening? There is no implementation. Okay, so this is just a simple example, and I'm sure you are also seeing this around you. And this is a major concern in LMIC and developing countries, the OTC of antibiotics. So let's move further. Let's not, go into detail of this. Module 3, resources and stakeholder engagement. So who are the players involved and what is the collaborative approach? So when we talk about the players involved in collaborative approach, we always talk about the stakeholder analysis. This is very important. So what is stakeholder analysis? It's a method used to streamlining the policy reform process, the policy making process, by identifying the people and entity who have a stake. So stake is nothing but interest in the reform. So this is a very basic, I would say, is the step of the stakeholder analysis, stakeholder engagement. So stakeholder analysis methods apply to a variety of tools on both qualitative and quantitative data to understand stakeholders and their deliverables, what is their position, how influential they are, what is their interest, what is their expertise, what is their interest level of whatever influence in the concerned field. In most cases, all these stakeholders, they fall into one or more of the following categories, which is very well known to us: international actors, national or political actors, which are nothing but legislators and governors, public sector agencies, interest groups, commercial, private for profit, non-profit organization, the PPP, that is public private partnership organization, civil society members, users, consumers, and I would also take it ahead and say students, the journalists, mass media people, artists, school children, parents. So these are nothing but all of them are stakeholder. It's just we have to identify them as what can be their role in this entire public making process. They can be, that's why precisely I said that can be of any size, form or capacity. It can be organized or unorganized. Identification is based on the objectives and integrity of the policy reform. So when we talk about AMR, AMR is something that deals with public health. Hence, it is applicable to every single human being on this planet Earth, including animals also and other living beings. Unfortunately, so SA provides detailed understanding of the political and socio impact, economical impact of reform on the concerned issue. Prior to introduction of the when stakeholder analysis should be done, what is the right time during this entire process? So it should be done prior to introduction of the reform and during the policy process. So basically, how this can be achieved? This can be achieved through in-depth analysis, focus group discussions, and expert interviews. So this is the example where I had mentioned earlier that I was a part of this project called Regulation of Antibiotics India, which was conducted by Delhi University, VP Chest Institute in collaboration of Edinburgh University. And the principal investigator was Dr. Anita Kotwani, who's the HOD of that institute, and Dr. Jyoti Joshi, who's a public health expert and working with ICAS now. So this was the study that we had done under their guidance: over-the-counter sale of antibiotics using NetMap to identify and segment stakeholders as the first step towards the development of smart regulation. So what is smart regulation? Smart regulation is nothing but the strategic regulation, the softer regulation, which focuses on multi-sectoral collaboration rather than bringing control and command and control in this particular concept. So softer regulation, smart regulation. Under this, what we did is we identified the problem. Problem is what? OTC sale of antibiotics. And we started mapping the different stakeholders that are related to this particular issue, and the result is in front of you, and you can also see the table. So basically, what is the significance of this circle is the close knit circle, okay, that speaks about the direct stakeholders who have higher authority, higher power, and higher interest in dealing with this particular issue. Layer outer to that, the middle layer, is nothing but directly related stakeholders, but who may have lower authority, who may have low power, and in maybe low interest in dealing with this particular issue. And the outer circle is, somewhere staggered, who are indirectly related to this particular issue, who may have higher authority, high power, who may not have it, who may be, highly interested in this particular issue, or who may not be highly interested in this particular issue. But the thing is, they are indirectly related to this particular issue. So I really hope you're able to, understand. This is a very nice project that we had done, and we could actually experiment and understand how important is stakeholder engagement in this particular process. So this this is nothing but, this method is called as net mapping of stakeholders. So module 4 is role of students in policy making. So here we are going to talk about the main factor as in how we can get involved in this entire process of policy making. So increasing awareness and lobbying to promote allocation of resources. So we will talk about lobbying because this is kind of a misunderstood concept, I would say, when we talk about policy making process. So lobbying is often taken in the negative, approach. But here, when we are talking about AMR, like I said, softer regulation. What is soft regulation? So we don't want to just, bring deterrent punishments on the antibiotics manufacturer and prescribers and, pharmacy dispensing antibiotics. But we want to bring a softer regulation which will negotiate with them, which will reconcile with them, which will engage them, involve them in this whole process, and create awareness, increase awareness among them regarding this issue and how harmful can misuse of antibiotics be. So lobbying is nothing but influence. So it is any endeavor by a person or private interest group to influence the decision-making process of the government. Influence in policy making is a core part of sound democratic system. So you can always find that, influence plays very important role. If you are a stakeholder, and if you think that you can be an impact, you can bring that influence in this whole entire process, then that nothing can be like that. So lobbyist is the interest group, as we can say, which can strengthen the policy debate. Lobbying can be seen at the national level. Lobbyists may associate with the legislative authorities, administrative agencies, executive machinery, however, in whichever way it is possible. Eminent professional researchers, think tanks, think tanks these days are playing very, very, very crucial role in increasing and spreading awareness about AMR in the society. Or public figures who can sensitize the interest groups about the promising policy. So there was this footballer, who just recently, who kept the cold drink bottle aside, and who just happened to, create this thing, which people called it as awareness, and people suddenly realized, okay, he's not vouching, he's not promoting this particular cold drink, so it might be harmful for us. And that's when the debate started. So that's how public figure can, play important role. Lobbying can also be achieved through public-private partnerships by improving P2G communication. So P2G communication is nothing but this partnership to government communication. Multidisciplinary approach, why it is required. I'm sure including me and all of you who are present over here, we are from different backgrounds. And I'm really happy that, it is going to that level, and we are really looking forward to this interdisciplinary approach in fighting against AMR. Why it is important? Because it is a way forward to One Health approach, which is evidently a significant tool in fighting against AMR. It is important in creating awareness and advocacy, which can act as an effective tool against AMR. Not only STEM, but also socio-economic perspective is also important to deal on the grassroots level. Okay, so STEM and socio-economic is still fine, but we also need mass media people, because we need to communicate the implication of of these particular cause, and recommend or suggest it to the ministerial level, to community level, to civic bodies, and etc. Art and culture, why do we need them? Because so that we can grab attention of the society overall. So whoever is a part of the society can give their bit of share in increasing awareness regarding AMR, can vouch for, promote for equitable use of antibiotics, can be a very, very, very important stakeholder in this whole policy making process. So policy brief as a tool, policy brief we have already discussed, via which you can give recommendations to a non-specialized audience. So basically policy brief is nothing but simplifying the policy and making it in a form so that it can be understood easily by the non-specialized audience. So again, what you need to know is what you need to know, what you need to do, and how to do it. So what you need to know is what is the problem, what are the factors impacting that problem, and who is the the group which is getting affected, largely affected by this particular thing. What you need to do is on what level you need to implement it, whether national level of intervention is important, or community level intervention, state level intervention, or maybe just a social activist advocacy is fine enough to deal with it. That you need to identify, and how to do it is the implementation process, which we have already discussed, through communication, through social media, through policies, reforms, regulation, etc., etc. So as we know, One Health strategic plan, that is already being discussed a lot. The One Health quadripartite is a collaborative framework of the FAO and UN. Even the environmental programs are being implemented to deal with this issue. Then there is the World Organization for Animal Health. I'm sorry. There is some. Yeah. Thank you so much.
Sorry about it.
That's fine. That's fine. Yeah, I'll just go back and support their respective members in also doing so. Okay, so I don't know whether I have time, Daniel. Is it okay if I continue?
We have a few minutes remaining. You can continue.
Okay, I'll just show this figure. That's why I've just mentioned the link, because this is very important. I think most of you must have seen it also. So this is very important. So here you can just ask the question and you can get the result. So just try this. If anyone of you have not tried this, is very important, very informative. It just tells you about how the NAP and GAP, everything is being implemented in all over the nation. All right. So review of NAP and AMR. So we already know the 5 main objectives of NAP. Okay. And most of the important, I think the main objective, as I identify it, as the awareness and understanding of AMR, which is, which lacks in LMIC. Okay, so we spoke about public policy making process. Apart from that, what is a legal framework of AMR? So it is nothing but the international treaties, conventions, as we discussed earlier, that is always there. Apart from that, regulation of antibiotics is also important. Like I mentioned, drug and cosmetic rules in India. Similarly, there are other statutory enactments in other nations as well, under the Pharmacy Act, the Drug Regulation Act, the Public Health Act, which talks about the regulation of drugs, and which also are reliant on the National Essential Medical List, which is very, very important, which is, given by WHO, but which is referred by a lot of governments in the world. So this is very important to achieve equitable, accessible, accountable, and sustainable use of antibiotics. Strict law for OTC sale of antibiotics. Reason, all of us know, we all are suffering because of that. And I live in metro city, but still the pharmacy guy next to my house, I have seen him giving antibiotic just without prescription, and to the patient who just knows the name of it, or who just says that give me antibiotic. And I think COVID has just worsened it, because people have popped up antibiotics as paracetamols. Price control regulation is also important, because that really affects the accessibility of antibiotics in LMIC and developing countries. Sanctions for WASH and IPC is important. Of course, there are other statutory acts as well, but sanction means in terms of binding rules to follow, WASH measures and IPC measures in the country. Incentivizing stakeholders which are involved in the antibiotic production. So this deals with patenting, patent sharing, emergency patenting. So if any one of you are a lawyer who will understand what I'm talking about, is because developed countries are very much involved. They have lots of patents, and pharmaceutical industry is just burgeoning with this. But somewhere in terms of antibiotic, they take a back foot because they have suffered a lot. They have had major financial consequences because of that. Because of antibiotics, they say it's not it's not economical, it's not sustainable, so they have stopped manufacturing antibiotics. So there is lack of access as well, and where it is accessible, there is misuse of antibiotics. So somewhere we have to achieve this balance, which can be achieved through patenting strategies. There is pull mechanism, push mechanism. If you go and read research papers about this, I have mentioned a few. They are very, very, very helpful. So that's why I mentioned strengthening of IP provisions and patent pool. Again, there is this link where we can identify there are 10 legal hooks that we can talk about, and these are the different treaties, different the international organizations, I would say, who deal with these issues. So this is also very important. So like first one, we can say develop equitable pricing and licensing model to support access to antimicrobials in resource limited setting. So TRIPS is nothing but trade related intellectual property, that is the secret and everything. IHR is international health regulation. Then Gavi is vaccination drive that has been happening around the world. So that's why I've just mentioned the list, because I was really not sure whether we'll be able to cover this or not. So you can always go through this link. These are very helpful links if you are trying to do something substantial in this field. Okay, so this I really wanted to conduct, but I don't know whether we are in time and time will allow us. So this is nothing but I've just tried to put 3 issues, and this is kind of an exercise for myself as well. So maybe you can just do it after this session, and I would like to know the result. I will tell you what needs to be done regarding this. So I've just tried to put 3 issues. What I want you to do is take this issue into consideration, any issue, 1, 2 or 3, whichever you like, and just think as a stakeholder that you have to design a policy. Okay, so how, considering the 5 steps of policy making process, how you can deal with this particular problem. Okay, how, so identify the problem first. Okay, what is it talking about, which sector is it talking about, who's getting affected by this, who can be the stakeholders. Okay, I would like to know the indirect stakeholders as well as the direct stakeholders that are involved in this. So this was the exercise that I really wanted to discuss with you, but I don't think so we are in time. But I would request you to please do this and share your results with Daniel. You can also share them with me, and I would like to discuss this further. So these are the list of references that I have taken into consideration, and I think that's all from my side. So I have written my email ID and everything. So if anyone wants to get in touch with me, please feel free to do that. And I'm always happy to assist you or help you with anything that you need. Thank you, everyone.
Thank you so much, Sneha, for that. Well, it has really been a very powerful and very engaging discussion, and I really appreciate that you really took your time to take us through the different levels of policymaking. On my end, I've also learned a lot, and I think we'll just take one question because we are out of time, and this was from Pius. So Pius was asking, so there's so many competing agendas for policy adoption. How best can we ensure that we get our agenda on the table, regardless of other competing agendas? Yeah.
Pardon, can you repeat the last part of it? What did you say? I missed that.
Oh, sorry. He was saying so we have so many competing agendas which call for policy adoption. So how best can we ensure that we get our agenda on the table, or we package our agenda as that we are on the table too, regardless of the many other competing agendas that also call for policy adoption? Yeah.
Yes. Interesting question. So see, when we, like I mentioned, when we talk about policy adoption, I said there are three levels of adoption. The adoption can take place at three levels. So statutory, okay, of course, maybe at this stage we cannot do anything about that, but there are rules and regulation. And I think what you can do is, as a researcher, as a scientist, as a student, you can always take initiative in uh, the implementation of protocols that happen at the community level of these particular. For example, see, NAP is getting implemented in most of the countries, and NAP is something that is, even if you go to a medical college that is closest to your place, you will see that there are some consequences, there are some implications of this NAP that is, being implemented in that particular setting. So maybe you can just go, you can just observe, you can just study that, and you can come up with some suggestions, and then you can discuss with that. Otherwise, what you can do is you can always discuss this with your state medical council, the district level medical council, because ultimately these are the bodies who will take your suggestions into consideration and who will have the authority to act upon it. So it's just that what we need to understand is we need to, just wake up and understand we are the stakeholder. We have to take these measures. We have to understand our role, as in how we can contribute to this particular cause in whichever form. Otherwise, social media is always there. I'm seeing so many of my friends who are from engineering background, but who are doing such good work with, coming up with creative videos that are creating awareness among, the society people. Then there is a group who is just exclusively working on, school children, who goes to visit schools, who talks to student about superbugs, what is superbug, how it is dealt, what is infection, and, these are the small measures. But see, we can only be optimistic. Like I said, it's a process and you can't be very sure of the result. There is always a chance of revision. But what you can do is, you can start, somewhere by, making a economic case, making a policy brief, studying a policy. Take one NAP for example, and just start writing a policy brief about that, and you will start going into depth of the that particular subject. And maybe then you can get into contact of the stakeholder who's closely related to that particular issue and who's in the vicinity of wherever you are. I hope that answers your question.
Yeah, thank you. Thank you so much, Sneha, for that. Maybe please you can respond. I think we won't take so much time because I'm sure it's very late on your end, Sneha. And I really do appreciate that sacrifice and taking us through the 4 modules, really taking your time to explain them to us. And I do appreciate, and I hope that we'll also have you in the future, so that at least we're able to continue these conversations and see how fast we can even,
Yes.
customize or even guide people who want to start the journey, yeah, in their
Correct.
respective countries. So thank you so much, and over to you for the final words. Then you can call
Thank
it
you
there.
so much, Daniel and team and SAS. You guys are doing wonderful job. And you had told me prior to this that I have to speak, and I was very keen to this session. Although I got a very little time to gather all the information, but yeah, it is always good to discuss this issue with students who are at the they are just beginning their journey as AMR activists, and I can see they are going to bring a great result in this journey. So wish you all the very best, and please stay in touch, and I would like to hear from you about your journey, how you are acting as a stakeholder in the policy making process. And I would love to see you reaching at that higher authority level and doing some credential work and commendable work fighting against this AMR. Thank you so much, everyone.
Thank you so much, Sneha. I'll share your presentation with the team. At least your contact is
Sure.
there, and also for reference to the different resources that you've shared with us. So thank you so much, everyone, and thank you so much for joining. To my co-coordinator, Anastasia. She was also in Future Leaders, Sneha. Anastasia, I don't know whether you maybe crossed paths then. And thank you so much, and have a wonderful evening to us all. Bye-bye, everyone.
You too. Thank you. Bye-bye, everyone.